Testicular torsion is defined as a urological emergency involving the twisting of the spermatic cord, which leads to ischemia and potential necrosis of the testicle. The key causes and risk factors include the bell clapper deformity, which is the most common cause. This is a congenital condition where the testis is not attached to the tunica vaginalis, allowing it to swing freely. Peak incidence occurs in neonates and adolescents between 12 and 18 years. Trauma or vigorous activity can be a precipitating factor. Classic symptoms are sudden severe unilateral testicular pain, nausea and vomiting, swelling and erythema of the hemiscrotum, a high-riding testis with a transverse lie, and an absent or decreased cremasteric reflex. The differential diagnosis, or must-rule-outs, include epididymitis or orchitis, which has a more gradual onset and is often associated with dysuria. Torsion of the testicular appendage, which presents with localized tenderness at the upper pole. An incarcerated inguinal hernia, and testicular trauma or tumor. The diagnostic workup begins with a physical exam focusing on the cremasteric reflex and testicular position. Doppler ultrasonography is the gold standard, as it assesses blood flow to the testis, with absent or reduced flow confirming torsion. A urinalysis is typically normal, helping to rule out infection. Emergency treatment follows the principle that time is testicle. The goal is intervention within 4 to 6 hours of symptom onset for a high salvage rate. Manual detorsion can be attempted at the bedside, often using the open book technique, rotating the testicle laterally to medially. This provides temporary relief before surgery. Surgical exploration, or orchiopexy, is the definitive treatment. The steps involve a scrotal or inguinal incision, untwisting of the cord, and assessment of testicular viability. If the testis is viable, it is fixed to the scrotum with non-absorbable sutures. If it is non-viable or necrotic, an orchiectomy or removal is performed. Contralateral orchiopexy is always performed on the unaffected side to prevent future torsion. Complications can include testicular necrosis and loss, especially with delayed diagnosis, infertility due to anti-sperm antibodies or reduced spermatogenesis, cosmetic and psychological impact, and infection. If you found this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.